What is biofilm in cystic fibrosis infection monitoring? Have you ever wondered how infections behave differently in people with cystic fibrosis? One key player in this process is something called biofilm. In cystic fibrosis, biofilm refers to structured communities of bacteria, primarily Pseudomonas aeruginosa, that grow within a self-produced matrix of substances like alginate. This happens in the thick, sticky mucus that builds up in the respiratory tract of individuals with cystic fibrosis. These biofilms can lead to chronic infections in the lungs and sinuses, making infection monitoring quite challenging. Biofilms are not just random clusters of bacteria. They are aggregates surrounded by an extracellular matrix made up of polysaccharides, proteins, and even DNA. This protective matrix is crucial because it shields the bacteria from antibiotics and the immune system. As a result, the bacteria can persist and thrive, even in high concentrations of antibiotics that would typically kill them if they were free-floating. This ability to survive leads to chronic lung infections and inflammation, which can cause progressive lung damage over time. When it comes to monitoring these biofilm infections in cystic fibrosis, healthcare providers focus on detecting these bacterial aggregates and assessing how susceptible they are to antibiotics. Traditional methods, like standard bacterial cultures, often miss the unique resistance patterns of biofilm bacteria. To get a clearer picture, specialized diagnostic techniques are used. These may include microscopy of sputum or lung tissue and biofilm-specific susceptibility tests. Such methods help healthcare providers understand the infection status better and guide treatment decisions. Regular infection surveillance in cystic fibrosis centers is essential. This includes monitoring for the presence and behavior of biofilm-forming Pseudomonas aeruginosa. By doing so, healthcare providers can optimize antimicrobial therapy and manage the progression of chronic infections more effectively. In summary, biofilm in cystic fibrosis infection monitoring is all about recognizing and tracking these protective bacterial communities within the lungs. They play a central role in the chronic infections that are characteristic of cystic fibrosis. Effective monitoring requires methods that take into account the unique growth patterns of biofilms. This approach ultimately aims to improve diagnosis, treatment decisions, and patient outcomes. Always remember, it is crucial to consult healthcare professionals for personalized medical advice regarding cystic fibrosis and its management.